Did you know most seniors leave a third of their lung power unused every day? Picture Martha, 72, pausing halfway up her porch stairs, heart racing, yet told her heart is healthy. Age-related lung stiffness can cut oxygen uptake by 20% after 70. But simple breathing tweaks can restore energy, balance, and restful sleep. Ever gasp after tying your shoes? Let's find out why ignoring breath mechanics is risky today. 1. Hidden perils of shallow breathing. Most problems creep in so quietly we blame age instead of air. Shallow chest breathing never lets oxygen reach the diaphragm, the dome-shaped muscle beneath the lungs that should drive every full inhalation. The diaphragm, by the way, is your primary breathing muscle. Think of it as a plunger. When it moves down, air rushes in. When it rises, old air flows out. With the diaphragm sitting idle, oxygen trickles in, carbon dioxide lingers, and the body complains. First sign, fatigue. Muscles burn fuel less efficiently, so ordinary errands feel like marathons. Second, dizzy spells. A bump in CO2 can scramble the inner ear balance center, turning a trip to the mailbox into a fall hazard. Keep breathing shallow and a hidden chain reaction begins. Within weeks, resting heart rate creeps upward as the heart pumps harder to compensate for thin blood oxygen. Months later, lower saturations starve the brain. Names slip, reaction time slow, wounds heal at a snail's pace. For anyone managing diabetes or high blood pressure, these setbacks stack on existing burdens, draining independence day by day. Long-term, chronic underbreathing can even accelerate bone loss and amplify nighttime sleep apnea spikes that quietly stress arteries. Short-term discomfort thus snowballs into chronic limitation, but it is also the stage most easily reversed. The encouraging truth? Lungs behave like any other tissue. Train them and they fully rebound quickly. Next, we'll layer in straightforward, senior-safe techniques that rebuild capacity step by gentle step and put every lost breath back to work.
2. 3-layer lung revival plan. Now that we understand the cost of idle lungs, let's roll up our sleeves and train them, gently, deliberately, and in layers that build on one another. Think of these layers the way you'd frame a house. First the foundation, then the sturdy walls, and finally the finishing touches that keep everything in shape for decades. At every stage, the motto is simple: apply sparingly, monitor, adjust. A. Foundation. Wake the diaphragm. Our first goal is to coax the big dome muscle back into daily service. Sit upright on a firm chair, feet flat, and place one hand on your belly, the other on your chest. Inhale slowly through your nose for a count of 3, letting the lower hand rise while the upper hand stays almost still. This tells you the diaphragm, not the shoulders, is doing the work. Exhale through pursed lips for a count of 4, feeling the belly fall. 1 minute of this belly rise drill 3 times a day can raise blood oxygen saturation by 2 to 3 points in the first week. Safety first. Stop if you feel chest pain, sharp back twinges, or lightheadedness beyond a mild head rush. Keep any prescribed rescue inhaler within reach if you have COPD or asthma. B. Optimization. Build endurance and calm. Once the diaphragm shows up reliably, we stretch the duration and add rhythm to settle the nervous system. A favorite among pulmonologists is the 4-7-8 sequence. Inhale through the nose for 4 counts. Gently hold the breath for 7, no straining. Then exhale through pursed lips for 8. That extended exhale nudges the vagus nerve, lowering blood pressure and heart rate, exactly the opposite of the stress spikes shallow breathing provokes. Start with just 4 cycles, once or twice a day. Over a fortnight, you may notice steadier pulse readings and fewer afternoon brain fog moments. Important: skip the breath hold if you're recovering from a recent cardiac event or if your doctor has cautioned against Valsalva-type maneuvers. Remember, apply sparingly, monitor, adjust. C. Enhancement and monitoring. Keep score, keep growing. With a rhythm established, we shift from guessing to measuring. An inexpensive incentive spirometer lets you see how much air you truly draw. Aim for 5 minutes of practice daily, recording the highest volume in a small notebook. Nothing motivates like yesterday's number staring back at you, daring you to nudge it higher. Pair the spirometer with light humming breaths. Think of a soft on the exhale. Humming vibrates nasal passages, releasing tiny bursts of nitric oxide that widen airways and help oxygen cross into the blood. Just 2 minutes of humming morning and night can leave sinuses clearer and sleep quieter. As always, pause if dizziness appears and never exceed 15 total minutes of spirometer work in a day unless a clinician supervises. Layer by layer, these practices reverse every danger we mapped earlier. Fuller oxygen banishes fatigue. Longer exhales steady balance. And objective tracking keeps creeping complacency in check. Some seniors feel a lift in stamina within 10 days, others in 3 weeks. The timeline matters less than consistent, mindful repetition. And if arthritis, vertigo, or schedule hiccups make any step awkward, don't worry, flexible substitutes exist. Next, we'll explore those personalized alternatives so you can stay on course even when the main routine doesn't quite fit. 3. Flexible alternatives and support boosts. Even with the best blueprint, some days the body refuses its assigned chores. Arthritic hips protest a straight-back chair, or anxiety spikes during long breath holds. That is exactly why every core routine deserves a wardrobe of swaps that achieve the same purpose or lend extra support when motivation dips. A. Equivalent alternatives. Same goal, different road. If the belly rise drill strains your lower back, pursed lip breathing can step in. Simply inhale gently through the nose for 2 counts, then exhale through lips shaped as if to whistle for 4. The narrowed exit slows the breath and keeps small airways from collapsing, a boon for anyone with chronic bronchitis. Its limitation is talkability. Talking companions may find the pursed mouth odd, so reserve it for quiet moments. For seniors who tense up at the 7-second breath hold of 4-7-8, box breathing evens the rhythm. In 4, hold 4, out 4, hold 4. The symmetrical cadence soothes racing thoughts without lengthy retention. Still, because the inhale and exhale are equal length, carbon dioxide washout is modest. People with COPD should monitor for mild breath hunger and shorten the holds if necessary. B. Additional support. Partial boosters. Mobility permitting, chair yoga spinal twists and side bends pry open stiff intercostal muscles between the ribs, allowing each subsequent breath exercise to inflate deeper. Choose this add-on when the torso feels locked in a barrel after prolonged sitting. The caveat: twisting beyond pain threshold can irritate vertebral discs, so move slowly and keep feet grounded. Prefer a social lift? Senior choir sessions or even 10 minutes of humming along to favorite tunes work wonders. Singing demands sustained out-breaths, naturally extending exhalation while flooding the brain with feel-good endorphins. Scheduling is the chief hurdle. Weekly rehearsals may clash with doctor appointments, but many community centers now stream virtual choir classes that fit any timetable. Tailor these alternatives like interchangeable puzzle pieces. Swap them in when joints ache, cabin fever bites, or you simply crave variety. Mixing methods keeps progress steady without boredom derailing the habit. Yet every swap carries its own safety notes, and some underlying conditions make certain techniques risky. Before adding anything new, let's zoom in on red flag situations and must-know warnings so your lungs and the rest of you stay protected.
4. Safety first. Contraindications and warnings. Safety first. There is no glory in pushing lungs or heart beyond their comfort zone. Before you deepen any breathing routine, run through this quick checklist with your physician or pharmacist. A. Medical red flags. Uncontrolled hypertension, readings above 180 over 110 millimeters of mercury. Unstable angina, a recent heart attack, or a fresh rib fracture, all demand professional clearance. Severe COPD or asthma flares likewise call for medical supervision. Even gentle diaphragm drills can feel like climbing a mountain when airways are inflamed. If you take opioid painkillers, benzodiazepines, or sleep aids, avoid long breath holds. They can compound drowsiness and slow the breathing reflex more than you intend. B. Immediate stop signs. Listen to the body's early alarms. End the session and sit upright if you notice chest tightness, sharp side stitches, blue-tinged lips or fingertips, spinning rheums, or a resting pulse rocketing past 130 beats per minute. These cues mean oxygen exchange has fallen behind demand. Resume only after vitals settle or a clinician okays it. C. Safe practice limits. For most healthy seniors, 10 breath hold cycles or 15 total minutes with an incentive spirometer per day is plenty. More is not better. The lung tissue needs recovery time just like muscles after a walk. When in doubt, split practice into 2 shorter sessions, morning and early evening, rather than one marathon.
D. Product quality and hygiene. Stick with FDA-cleared spirometers, reputable nasal strips, and sterile saline for sinus rinsing. Cheap, unregulated gadgets can harbor mold or offer inaccurate readings that sabotage progress. Wash reusable mouthpieces in warm, soapy water after each use and let them air dry completely to keep bacteria at bay. E. Interaction with existing therapies. Pacemakers, supplemental oxygen, or continuous positive airway pressure (CPAP) machines are not deal breakers, but they do tweak the rules. Coordinate timing so breathing drills never overlap with scheduled medication peaks or CPAP ramp-up periods unless your respiratory therapist advises. Staying alert to these guidelines transforms worry into confidence. By knowing your boundaries, you safeguard hard-won lung gains and build trust in the routine. Now, how do you tell when the work is paying off or when you need to tweak the plan? The answer lies in a handful of simple, trackable improvement indicators that turn every inhale and exhale into measurable momentum. 5. Tracking progress. Progress rarely arrives with fanfare, so we need a clear scoreboard. Pay attention to 2 kinds of signals: what you feel and what you can measure. A. Subjective milestones. Within the first 2 weeks, many older adults notice they can stand at the sink and wash a full stack of dishes without pausing for breath. By week 3, a 15-step staircase may no longer require a mid-flight rest. Keep an eye on sleep quality too. Jot down how many mornings you wake up feeling refreshed rather than groggy. When that number reaches 4 or 5 days a week, your lungs are pulling their weight again. Rate afternoon energy on a simple 1 to 5 scale and circle any day you score a 4 or a 5. Rising averages are a green flag. B. Objective checkpoints. Numbers remove guesswork. Record your top incentive spirometer reading once a day. A jump of 150 to 200 milliliters over 6 weeks means the diaphragm has strengthened. If you prefer walking tests, time how long you can chat with a friend at a brisk mall pace before needing a big inhale. Stretching that conversation window from 20 to 30 seconds is meaningful. A fingertip pulse oximeter adds another layer. Resting oxygen saturation edging up from 93% to 95% is small on paper but huge for tissues. Log all data in a pocket diary or notes app, along with which technique you practiced, date, method, duration, and any unusual sensations. C. Interpreting the data. Sort results into 3 buckets. Good enough to maintain appears when energy stays at 4+, spirometer volume climbs, and stairs feel easier. Keep the routine steady. Needs optimization shows up when energy hovers at 2 to 3 or numbers plateau. Adjust by adding 1 extra practice set or swapping in a fresh alternative. Stop and consult is rare but vital. Sudden dizziness, saturations dipping below 90%, or rapid heartbeats that don't calm within 5 minutes all require professional review before the next session. Track, review, adjust. This cycle turns progress into habit and habit into health. When your logbook shows brighter mornings and stronger numbers, you're ready to lock the lessons in place and share what you've learned with the world. Before we wrap up, drop a note below describing the breathing struggle, symptom, or health condition that worries you the most. I read every comment and will respond directly, or feature tailored advice in the next video, so the whole community learns together. My goal is simple: help you safeguard health and enjoy more moments with the people you love. If this guide helped, please tap like and share it with friends who might need the same boost.
6. Core takeaway and mantra. Shallow, hurried breaths quietly steal strength, balance, and peace, yet structured diaphragm work, paced rhythms, and clear tracking restore oxygen and confidence. Remember the safety checkpoints, swap techniques when necessary, and celebrate every extra step or deeper night's sleep. They prove your lungs are relearning their full range. Keep the practice steady, and each day adds a little more life to the years ahead. With patience and curiosity, you'll discover that mastery over breath is the simplest, most portable medicine you can own everywhere you go. Remember, every focused inhale and mindful exhale is a vote for independence, mobility, and joy tomorrow. Let the quiet rhythm of your breath become the steady drumbeat guiding your golden years. Breathe slow, live strong.